Health Organization, obviously for a normal Caucasian, if your BMI is 25 and above, you're overweight. But for Asians, it's actually 22, 23. Okay, so we're meant to be skinnier. So, all right. Yeah, and that's the next point. The next study, prevalence of severe sleep apnea is higher despite of lack of obesity in Asians. Because, yeah, mid-face deficient, smaller airways. Yeah, Chinese have higher, so Hispanics, Mexicans. Sleep apnea continuously increases with age for both men and women, but the women tend to be a later onset. Men are 3 times more likely to have it, and yeah, especially if you're over 60 years old. And men are significantly more likely to report OSA symptoms, probably because men tend to snore a lot more, but are less likely to have things like insomnia. Women tend to have that. But with women in particular, what I find a lot is, I see this a lot in my practice, especially the younger females, they have upper airway resistance syndrome. So they have less severe OSA. You guys haven't learned AHI yet. AHI is a scoring system, so it's pretty much how many times per hour you stop breathing for 10 seconds or more. So if it's not 10 seconds, it doesn't register as an apnea. So what a lot of younger females tend to have is upper airway resistance. So they may stop breathing for 7, 8, 9 seconds, but not quite 10, so it doesn't register. But they have all the same symptoms as someone who has sleep apnea. So we see that a lot more in females. So yeah, episodes of upper airway resistance that do not meet the criteria of apneas are more common in women. So how does it affect your health? Okay, so patients with sleep apnea have higher prevalence of cardiovascular diseases, respiratory diseases, metabolic disorders, a lot of other things like peptic ulcer disease, gastroesophageal reflux, chronic liver disease, anxiety, insomnia, and depression, because yeah, it affects your brain as well. Soft tissue surgery seems to, in this study here with over 50,000 patients, showed that you had a better result in fixing complications compared with CPAP. So, speaking of CPAP, Colin Sullivan, the inventor, who's an Aussie, came out October last year, released an article saying, yeah, it was telling everyone, yeah, it's not meant to be for long-term use. It was meant to be a rescue therapy.